This is someone's eye that didn't fully get out of the way of the pupil. Now, this is actually one of my cool patients, and you would think by looking at this that maybe those iris strands would restrict the vision or maybe make it difficult for that patient to see or reduce the vision a little bit, but no. This patient has perfect 20/20 vision, sees really, really well. This is called a persistent pupillary membrane, and it's actually more common than you'd think. I bet a lot of people have this and don't even know it, and they're walking around and not affecting their vision. During development, the iris is formed with a complete sheet of tissue called a pupillary membrane. And at the 6th month of gestation, the central part where the pupil is going to be, that tissue starts to dissolve and go away, forming the pupil. But sometimes you're left with some strands that are still attached that don't fully dissolve away, and that's why it's called a persistent pupillary membrane. Now, in most cases, like in this case, it doesn't really affect their vision. It's good to always get the eye exams and monitor it, but usually is not a problem at all. In some cases, if there's a lot of leftover or a big persistent pupillary membrane, it can block the vision and hinder development and cause amblyopia, or a type of lazy eye, making that eye not see very well or not develop properly. And so then it can become critical or a good option to remove that pupillary membrane, either through a laser type of procedure or a surgery. You know if you have a persistent pupillary membrane?